Hi, I'm Dr. Joan Norton. I'm a chiropractor from Scottsdale, Arizona. Actually, I'm a retired chiropractor. When I was in my mid-60s, I started having some pretty serious health problems and had tried all kinds of natural techniques and natural products and just had very little positive results. Definitely not what I was looking for. While sitting in the back of a classroom getting my CE hours, I was very fortunate that it was a very boring class, so I took my book and I went to the back of the classroom to finish reading it. And the book was Breakthrough. And when I came to chapter 33, it was an interview with David Schmidt. Well, as I was reading it, it sounded too good to be true, to be honest with you. But the more I read, the more excited I got. And I started thinking, what if it's true? What if I pass up something that can really change my quality of life? And not only change my quality of life, maybe even my quantity of life. So by the time I got home, I was completely sold, and I knew that I had to try these out at least. So I ordered the patches, and they came several days later. So we just put them on according to the pictures. Normally, by the end of a 10-hour day, I was so exhausted that I could hardly make it home to hit the couch. Well, we put the patches on and I went to work, and I didn't really pay any attention. You get so busy. But by the end of the day, I realized I hadn't sat down. I wasn't tired at all. I had no pain. It was pretty exciting. And by the end of 2 days, I had almost forgotten I'd ever been sick. It was pretty incredible. So I decided that I was going to try it on some of my more difficult cases. And I was amazed at the response I got, because people just had these miraculous things happening. And they were telling all their friends and their neighbors, and they were dragging them into the clinic, to the point that within the first 30 days, it increased my referral rate, excuse me, by 25%. So I started selling them just wholesale retail in the clinic for a multiple stream of income. And it was only, I guess it was about a year and a half after I introduced them that way, that I ended up selling the practice and working LifeWave full time. And I'm absolutely loving my life. I can work when I want, I work where I want, I choose my hours. Instead of planning my whole life around work, I now plan my work around my life. I'm fast approaching 70, and as you can imagine, I've had several careers in my lifetime. But my favorite form of self-employment before LifeWave was as a management consultant to medical professionals, primarily chiropractors and naturopaths. And I really loved that job. I was my own boss. I had control of my schedule. I got to choose who I worked with, and I made a great income. The negative parts of the job was I was paid by the hours that I worked, while I was making doctors a fortune. If I didn't work, I didn't get paid. If I was sick, I didn't get paid. There was no form of retirement income, and my success depended totally on a doctor being successful, and there was only so much of that I could control. So I decided that I wanted to go to school to become a chiropractor. Seeing all the money I made them, I got a little greedy and decided, why shouldn't I have some of that for myself? So at the ripe old age of 53, I graduated from chiropractic school, and I moved to Tucson, Arizona, and opened a practice. We had a very successful practice and clinic for about 12 years, but I really felt that I went backwards in my quality of life. I was making a great income. I had great personal feelings of satisfaction of really helping a lot of people. The bad parts about it, I began to feel like a caged animal. I was tied to a clinic location. I worked set hours. I had no control over my work schedule, and my income was again limited by the number of hours that I could physically work. I was actually still an hourly employee, even though I was working for myself, because if I took time off, I didn't get paid. So when I found LifeWave, I had no intention of working it. I was just using it as a multiple stream of income in the clinic. And that little multiple stream grew into a raging river to the point that I felt that I could sell my practice and work LifeWave full time. And am I ever glad I did? Because in the past, I had to schedule my life around whatever job I had. And now I have the opportunity to schedule my job around my life. I can work from anywhere I want, and I'm the only one that's in charge of the amount of income I make. I'm paid by the results, not the number of hours. Finally, it's the first time in my life. I get to decide who I work with. So I still have the joys that I had in the consulting business. I had the good parts, and I don't have the bad parts. Instead of helping doctors make an additional income now, I help doctors and all team members make an additional income. And I'm part of a group of people who are committed to helping the world become a little better place.